The treatments range from psychosocial, of which there are numerous types of psychosocial treatments, and those have been really the standard treatment that's been applied in the community. So it involves things like cognitive behavioral therapy, 12-step facilitation approaches, which uses the 12-step model for treatment. There's also contingency management, which is more reward-based. In children or adolescents, you'll hear a type of treatment called multidimensional family therapy, which engages the family and teaches them skills in working with adolescent populations, or CRAFT is another approach that's used with adolescents. So there's a wide range of therapies. It's important to recognize that AA and NA, which is Alcoholics Anonymous and Narcotics Anonymous, are widely available in the United States and are very helpful for individuals, but you have to view it as more mutual help or mutual improvement, mutual help, rather than viewing it as therapy. Often it's not enough for a doctor simply to say go to AA and that being treatment, but it's something that can be very helpful for a subset of patients and is worth considering, and often in conjunction with therapies that a psychologist or a psychiatrist might provide. In terms of what's approved by the FDA, there's a number of treatments that are available for nicotine use disorder. We often forget about nicotine, but nicotine is the most commonly misused, abused, or I should say abused substance in the United States, closely followed by alcohol. There are 3 available FDA-approved treatments for alcohol dependence, acamprosate, naltrexone, and disulfiram. For opiates, probably the one group that is in desperate need of more pharmacologic interventions are the opiate use disorders, because of the opiate epidemic and the risks of overdose, which is so clearly present going on in the United States right now. The treatments that are available for opiate use disorders include methadone, buprenorphine, and naltrexone and Vivitrol, which is an injectable form of naltrexone, which is very interesting. But there are no pharmacologic FDA-approved treatments as of yet for cocaine, methamphetamine, or marijuana. So we certainly have a long way to go. People often make this distinction of which treatment is better, and I don't think it's a function of which is better. I think that based on the patient, it depends on whether they need simply psychotherapy treatment or whether they also would benefit from pharmacotherapies. I think in general, pharmacotherapy treatments are very much underutilized here in the United States as well as in the rest of the world, and there's a lot of people who could benefit from pharmacologic interventions, and at least at present have not been treated in that fashion.